Some of the common areas of specialization in medicine and surgery are the general physician, who diagnoses and treats the everyday and sundry ailments of the human body. General surgeon, who specializes in surgery of all the organs in the body. He can further specialize in specific areas, and the duty involves examining the patient to determine the extent and the nature of injury, treatment through operation, and giving post-operative care. Surgery is of various types like orthopedic, plastic surgery, neurosurgery, etc. Anesthesiologist administer anesthetics to the patient undergoing surgical operation according to the nature of the operation. It is he who makes the surgical procedure as painless as possible. His duties involve examining the patient to determine his capacity to withstand shock of operation and anesthesia. He or she has huge responsibility and has to be present throughout the operation. Psychiatrist diagnoses and treats mental disorders. Psychiatry has two major branches. The first is psychotherapy, the application of psychological techniques to the treatment of mental illness, and this branch uses non-drug therapies and will not use physical techniques such as drugs or surgery. The second branch is psychiatry, where medical therapies are used. After diagnosing physical and behavioral symptoms, drugs and other means may be used for treatment. The neurologist diagnoses and treats diseases related to brain and nervous system, and he also specializes in neurosurgery. The pediatrician treats newborn babies and children. Ophthalmologist or eye specialist treats diseases and disorders of the eye. Pathologist investigates the cause of various diseases and the possibilities for their prevention. His duties involve constructing chemical, microscopic and bacteriological tests in labs and examining blood, tissues, urine, etc. to find out the cause of the disease. The cardiologist, also called the heart specialist, treats diseases relating to heart and circulatory system. The gynecologist and obstetrician diagnoses and treats diseases and disorders of human-female reproduction system. They care for pregnant women from conception through delivery. The dermatologist specializes in the diagnosis and treatment of skin problems. The orthopedist deals with diseases connecting to the skeletal system. Orthopedics is that branch of medicine that deals with the correction of deformities and prevention of disorders in joints, muscles, tendons, ligaments, cartilage, and all bones and bone tissue. The gastroenterologist treats diseases related to the liver, pancreas, stomach, intestines, bowels, and gallbladder. The radiologist diagnoses diseases and disorders by studying X-ray pictures of affected parts and giving treatment such as therapeutic radiation to the affected parts of the body. ENT specialist treats disorders of the ear, nose, and throat. Tuberculosis specialist treats ailments due to the infection by the tubercular disease. The venerologist treats venereal or sexual diseases. Bacteriologist, also called the microbiologist, conducts research and laboratory experiments on occurrence, growth, development, control and utilization of bacteria and other microorganisms. The physiologist studies normal functioning of different organs and tissues of the human body and investigates effects of physical environment such as variations in altitude, speed, temperature, etc. on its vital functions. The nutritionist gives instructions regarding food value and utilization of food in the human body to keep it healthy and control diseases. He prescribes diet for various diseases. Chiropodist, called the pedicurist, treats foot diseases and abnormalities. He treats corns, blisters, etc. using surgical instruments. Why do we study? What is the end of education? Isn't it careers? But when there are so many careers to choose, how do I choose the right career? How can I make my decision right? My future depends on my decision. Which career is the right choice? Careers are confusing. Should I decide my career based on my potential, my capability, my talent? Or should I focus on what are the opportunities available and work on what are the opportunities in society? How do I choose? Environmental conditions, family conditions, my genes, opportunities. It's also confusing. Careers, a tough choice.